Hello, my name is Valerie, and I'm a physical therapist who treats pelvic dysfunction as well as general women's health issues. And I wanted to make a video today explaining about SPD, what it is, what causes it, what you can do to treat it. And it is a particularly timely video to do because I am currently 8 months pregnant and I have SPD myself. So not only is it a condition that I've treated in the past and treat currently with patients, but I'm currently self-treating myself. So I got to kind of practice what I preach and really see how awful it is, and also what really works, not just for myself, but again, my patients. So what is SPD? SPD stands for symphysis pubic dysfunction, which is a fancy way of saying pain in your pubic area. So what is your pubic area? Your pubic area is the area where you have pubic hair, is probably the best way to get it, kind of right in this area right here. But with SPD, the pain doesn't necessarily always stay right here. It can radiate, it can move, especially if it's more severe, you've had it for a while. The common places where the pain spreads, or it can start here, it can kind of cause pain in your lower abdomen, it can cause pain on the front of right here and down your thighs. It can cause pain in your bottom, and by bottom I mean two areas. I mean like bottom like here, and also bottom like your butt. It can also cause pain kind of in your low back. So it's not something that just stays right here, all right? In general, the pain is described as being painful in that area. It's often described as a shooting pain or a grabbing pain, a pain that stops you in your tracks. It can be caused by movement. The typical movements that tend to be the most jarring are rolling over in bed, walking, standing on one leg, stairs, and anything where your knees go apart. Squats, picking stuff off the floor can also cause pain. It can grind, it can cause clicks, it can cause pops, all those things. In general, there are a couple provocation tests that we do in clinic to diagnose it. Provocation test means when you do or put yourself in this position, it replicates or aggravates your pain. So the first provocation test is that it hurts to touch on your pubic bone. So if you were to lay back and kind of just touch on your pubic bone, it's not happy. It doesn't feel good. The second provocation test is what's called a Faber, and that's when you kind of get into the guy cross-legged position like this, and you push your knee down. If that triggers your pain, then you may have SPD, especially if it triggers the pain in, again, the pubic area. Another one is that when you walk, you waddle. Like you can't walk without kind of having to weeble wobble your shoulders side to side like this and take small, kind of tiny duck steps. And lastly, I'm going to turn around. Another sign is that when you stand on one leg, if you put your hands on your hips drop like that. So you can't stand on one leg and keep your legs level, it kind of drops. So if you're having pain in your pubic area or surrounding areas, and some of those tests are positive, you may have SPD, it's probably a good idea to talk to your midwife or your OB about what can be done about it. So this next little bit is talking about what causes it. And what most doctors and midwives will tell you, it's relaxin. It's the hormone that you get while you're pregnant that makes your muscles and your ligaments kind of pliable and loose. And that's an important hormone because it allows you to give birth to your baby without ripping yourself apart, and then also, bounce back afterwards. So we like relaxin. The only problem I have with that is that relaxin levels in your body peak at 12 weeks pregnant. And most women don't start experiencing SPD symptoms until second, third trimester. Some do in first trimester, but most it's a thing that the farther along you get, the worse the symptoms get. But the relaxin, that's not building up more in your body. So I don't think it's the relaxin. The second thing doctors will often say is, oh, it's because you're hypermobile. Well, I'm an incredibly inflexible person, and I have it, and most of my patients aren't hypermobile that have it. So the third thing that nobody will really tell you about, but is my own little pet theory, because I've yet to treat a patient or have a patient with SPD that does not have this, myself included, and that's bad posture. So what postures tend to promote SPD? This is the posture I have, which is I have low tone, meaning I'm not a super strong person. I've never been super strong. When I was a kid, I had a hard time reading, I had a hard time talking, those sort of things. And you're going to want to get kind of like around the hips. What I do is I tend to, I'll turn this way so you can see, when I stand still, I tend to turn my toes in and lock my knees. Now, not everybody stands like this that has low tone, but it's very common for people with SPD to lock their knees or take their knees and kind of move them all the way back like that. When you lock your knees, what happens when you're pregnant is it throws your pelvis forward into what we call an anterior tilt. And that anterior tilt position promotes tightness in the muscles right here and strain in the muscles back here. Okay? It also stretches your stomach and makes it hard for those stomach muscles to kick in. And in general promotes kind of this sort of, I call it like a Bill Gates or Taylor Swift posture. Like that, you know, especially since we're vain in America and we don't want to have a double chin. So we stick our neck out nice and long. And this posture is pretty much the posture that 99% of SPD patients have. Maybe not as severe as I'm making it right here, but to some extent, one of these things is happening. Their chin's forward, their shoulders are forward, their pelvis is tilted anteriorly, their hips are locked, or their back is very swayed, like this. One, if not all of those are present. Again, my culprit is I lock my knees. Like, I like to think the rest of the time I've got fairly okie dokie posture, but I am somebody that locks my knees all the time. So, one of the ways you treat SPD is stop doing that posture. If you lock your knees, stop locking your knees. If you like to put your chin forward, stop putting your chin forward. You want to try when you stand to have a straight line from your ear, right here, to the tip of your shoulder, from the tip of your shoulder to the top of your hip to your knee, knee to ankle. You want that to be nice and straight. We call that plumb. You want a nice, nice straight one. You can do this by grabbing like a mirror and kind of standing and looking in the mirror into your bathroom mirror like that with a hand mirror and just looking and trying to pull yourself up as tall as you can. And then I tell people get as tall as you can and then relax 2 clicks, 1, 2. And that's where you want to kind of hold it and try to stay out of this posture. This posture is going to make your SPD worse. It's going to make you hurt more. So try to break that habit now, especially as you get bigger, as your pregnancy goes on. It's just the belly's going to want to pull you into that awful posture. So fight it. Okay. Other things you can do to treat SPD other than what I think is one of the, if not the cause of something that happens in time with it, is to stretch. There are some muscles that like to get tight and that are pretty much always tight in patients with SPD. The first one is your hip flexors, or the muscle that kind of goes from your knee to the top of your hip right here. So you're going to want to stretch that out. I'm going to put this on the floor for a sec. And there are a couple different ways to stretch it. One is you can grab your ankle like this and stretch it like that. And you can see I'm really tight. If I wasn't tight, this knee right here would line up with my other knee. And when I'm not pregnant, this knee does line up with my other knee. I could very easily do ta-da! You know, so I'm doing this right now, but I don't know if you can see I'm cheating. I'm arching my back. So this is one way to stretch it. The second way you can stretch it, that's often a more comfortable way. Let me kick off my shoes. Is to lay down on a couch or a bed and leave one leg off. And then take that leg and just pull it back and drop that knee down until you feel a stretch right here. What's great with doing it this way is it keeps you from cheating. You know, when I stood, I arched my back to cheat. You can flatten your back real easy by bringing your other knee up. And then you get a good stretch right there. And you just hang out here for about 2 to 5 minutes. Get a good stretch, switch sides, and do it on the other side. If you can get so that this leg can practically kick your bottom and you're not feeling a stretch, you're not tight. Don't worry about it. But most of my patients with SPD are very tight here. Okay? So, that's the first thing you can stretch.